Bismillahirrahmanirrahim. এখন আমরা একটা ছোট লেকচার নেব যেটা applications of antigen antibody reactions in diagnosis. এটা খুব গুরুত্বপূর্ণ। আমরা শুধু প্রিন্সিপালটা এখন ডিসকাস করব, ইন্ডিভিজুয়াল রিঅ্যাকশন গুলো না। এটা অনেক কাজে লাগবে। So Bismillahirrahmanirrahim. Rabbi zidni ilma. Rabbi shrah li sadri wa yassir li amri. Wahlul 'uqdatam min lisani yafqahu qawli. Sallallahu alaihi wa sallam. Antigen and antibody reactions in diagnosis, that is diagnostic immunology. What are the review questions after this lecture? What are the types of antigen antibody reactions in vivo and in vitro? What is the basis of this test? What are the applications of antigen antibody reactions? How antigen antibody reactions help in diagnosis of diseases? What are the advantages and limitations of immunological tests? What types of diseases can be diagnosed by antigen antibody reactions? And questions regarding individual tests. Types of antigen antibody reactions in vivo, that is within the body. In our body, when an antigen comes in contact with an antibody, following reactions occurs: agglutination, precipitation, complement fixation, neutralization, antibody-dependent cell-mediated cytotoxicity, and immobilization. You all know this. And the final result of this antibody-antigen reaction is to eliminate, destroy, or neutralize the bacteria or virus or any pathogen. What are the types of antigen antibody reactions in vitro, that is outside the body? The antigen antibody reactions that is within the body, that is agglutination, precipitation, neutralization, complement fixation, can also be done outside the body. And besides this, in vitro, some other lesion-mediated reaction like fluorescent antibody technique, ELISA, or enzyme-linked immunosorbent assay, radio immunoassay, immunochromatography test are done in vitro. What are the uses of antigen antibody reactions in vitro? Number one use is diagnosis of many diseases. Number two, to assess the severity of the or stage of the disease. We can say acute disease, chronic disease, convalescent disease, etc. We can also assess the response to the treatment. For example, by doing titer of VDRL test. In untreated patient, active cases, titer is very high, and after treatment, the titer is low. Epidemiology can be, there are epidemiological applications by this antigen antibody reaction. For example, sero survey, we can determine the seroprevalence of any disease like chikungunya or presently COVID. We can estimate how many people have already been infected by COVID by doing the antibody test. How antigen antibody reactions in vitro helps in diagnosis. Regarding infectious disease, it helps by determining whether an individual has developed antibodies in response to infection. We all know that when an antigen or immunogen enters into our body, in response to the antigen or immunogen, some specific antibodies developed. So, if we find any antibody, we can say yes, that disease has occurred. Or we can diagnose by detecting the antigen of a particular infectious agent from blood or body fluids. Autoimmune disease can also be diagnosed by antigen-antibody reactions. How? By detecting antibody against particular self-antigen. Say, for example, antibody against RBC, WBC, or platelet, or antibody against any tissue. Tumors can also be diagnosed by antigen-antibody reactions by detecting tumor markers. And tumor markers are also their antigens or antibodies. Some metabolic disease can also be diagnosed by antigen-antibody reactions because most of the metabolic diseases are caused by increase or decrease of the hormones, and hormones are proteins, so we can diagnose either that hormone is increased or decreased by immunological test, like hypothyroidism, hyperthyroidism, and many other hormonal diseases. Physiologic conditions like pregnancy can also be diagnosed by antigen-antibody reactions by detecting human chorionic gonadotropin in the urine, pregnancy, commonly known as pregnancy test. So, by antigen-antibody reactions, not only infectious diseases, but many types of diseases like infectious, autoimmune, tumors, metabolic disease can be diagnosed. Among the infectious diseases, bacterial, viral, protozoal, fungal, parasitic, all diseases can be diagnosed. And most of the viral diseases are diagnosed by antigen-antibody reactions only, by detecting antibody and sometimes antigen. Many bacterial diseases can be diagnosed by antibody. Protozoal disease also can be diagnosed by both detection of antigen and antibody. Many autoimmune and tumors. There are other examples, immunological affliction in the laboratory care. Bacteriology, virology needs to be identified from culture. We can type and we can identify their strain also. What is the basis of antigen-antibody reactions? The antigen antibody, the basis is the specificity between antigen and antibody is the basis of diagnosis, because except some cross reactions, specific antibodies are developed against particular antigen and it reacts specifically with that antigen. So if you can detect the antibody, you can detect the diagnosis, or if you can detect the antigen, directly detect the diagnosis. There are some analytic performance of a diagnostic test. Often you will listen that this test is highly specific, this test is highly sensitive, like this. So what it means actually, sensitivity is the measure of true positive rate and specificity measure of true negative rate. How it is calculated? Sensitivity is calculated number of true positive and number of actual positive. Say for example, 100 people are suffering from COVID. Out of them, by any test, 80 becomes actually positive and 20 were not positive. So sensitivity of that particular test is 80%. Say for example, nowadays you know the sensitivity of RT-PCR is 70%. That means it misses 30%. 30% will be false negative. They were actually suffering from disease, but this test could not diagnose them. So high sensitivity means it will diagnose the all actual positive cases. What is the meaning of this? Specificity is measure of true negativity rate. That is number of true negative divided by number of actual negative. And actual negative means true negative plus false positive. They are actual negative. Say these are usually used in the screening test. Say for example, you are going to screen blood in the blood bank, you are going to screen whether they are suffering from hepatitis B or C. Say 100% are actually not suffering from hepatitis B. If any test can detect this 100% as 100% negative, then we specifically be 100%. But if out of 100%, some test can give that 5 are positive, that is false positive. So that specificity will be 95%. So for screening test, the specific, highly specific tests are required. What are the limitations of these antigen antibody reactions? First limitation is cross reaction between similar antigen and antibodies. Cross reaction, so these have got some advantages as well as the disadvantages. For example, you know about the Weil-Felix reaction. By protozoal antigen, using protozoal antigen, we can diagnose rickettsial fever. This is an example of benefit of cross reaction. Otherwise, the cross reaction gives rise to false positive test. Some time is required for development of antibodies against any infectious agent. Usually it is 2 to 3 weeks. So from the date of infection, 2 to 3 weeks, and from the date of sign symptom, maybe 1 to 2 weeks. So you cannot diagnose within 1 to 2 days by this detecting antibody. But by detecting antigen, you can diagnose from the very date of infection. And another limitation is the antibodies remain for many weeks to months even after cure of the disease. So the patient is now okay, no sign symptom, but if we do the antibody, you can still antibody can be present. For example, a typhoid fever patient, his fever is no fever, is all right, but the antibody titer, viral test titer will remain high for many weeks. And in some cases, say for example, in case of syphilis, TPHA can remain lifelong, and that's why it is known as immunological scar. Even if the patient is cured from syphilis, the antibody will remain there. So, in spite of these limitations, how infectious diseases are, how antigen antibody reactions helps? By determining IgM antibodies is a reflection of recent infection. If we get any IgM antibody, we can say yes, he is actively suffering from the disease. And if IgM antibody tests are not available, then rising level of IgG antibody often indicate recent infection. Rising level means 4-fold rise between the first sample and second sample doing 1 week apart. Sometimes a very high titer of antibody will also signal a recent infection. A common example is, say, if you see a viral test T or TS is 1:640, it will be a signal for recent infection. So this is about the principle of the antigen antibody reactions for diagnosis of diseases. We will discuss in details about different types in another lecture. Thank you very much. Assalamu alaikum wa rahmatullah.